Hello everybody, today we're going to talk about the urine nitrite test, which is a test that is done on patient urine samples to check for infections. The topics we're going to cover are what are nitrates and nitrites, how the test is done, reading the results, the symptoms that you may have when the test is done, and some special cases. First of all, what are nitrates? This is ATES. Green vegetables like spinach contain nitrates. These are absorbed through the food and excreted in the urine. They are totally normal and they aren't tested. So then what are nitrites with the ITES? If you have an infection in the urine, your bacteria are going to act on those normal nitrates and convert them to nitrites. These are not normal. Now, the urine must be in the bladder for at least 4 hours for the nitrites to be produced, and a lot of bacteria needs to be there for these nitrites to be generated. So, how is this test done? The test is a simple urine dipstick test where a strip impregnated with some chemicals is dipped into the urine sample, and after 2 minutes the color of the strip will change. Normally the color is then red with a machine. The chemical reaction that takes place is a little complex. Diazotization of sulfonilic acid with nitrites gives azocoupling, and a pink color is seen if the test is positive. You may have interference with the test results if you are on vitamin C supplements or antibiotics, so make sure to check your medications when you go in for this test at the lab. So this is a simple two result test. It's either negative, or if it's pink, it's positive. There is no grading in this test. What do the results really mean? Where a light gray color is basically negative or normal, it means that there are fewer than 5 leukocytes, and any pink uniform color means the test is positive and you could have an infection. Some related symptoms are fever, burning of the urine, pain in the stomach, or chills, all of which mean that there is a urine infection probably there, and that's why the test was positive. So when is this test done, in which groups of patients? First of all, to investigate the urine symptoms that I just told you about. It should be done together with tests like pus cells, RBCs, and more. Also, in pregnancy, pregnant mothers should be screened for urine infections, and that is when this test should definitely be done. It's also recommended for very old people or those who are diabetics, because they are prone to urine infections, as well as people who have things like HIV or tuberculosis and chronic diseases, because they too can have urine infections. There are some special scenarios in which the nitrite test can produce confusing results